people to access cancer services like radiation therapy, they have to travel to these big centres. And so if you come from a position of deprivation and you can't afford the cost of travelling to these centres, the cost of accommodation, being away from your whānau or your family while you're undergoing treatment for a length of time, all of these things contribute to access barriers for Māori. So in New Zealand, we often talk about it as a postcode lottery, meaning if you've got a postcode that sits within a big centre, a cancer centre, then your ability to access those services is much better than those that are outside of that. So my role is also around working with social services to ensure that, to mitigate the risk of an access barrier, that we assess those things early for our Māori patients to be able to come and access funding and all of the support services that are required to get a patient into the service and through to the other side with a good experience. I think there's individual factors that impact access, and that will be people's prior health experiences impact whether they'll come forward. They might have had a whānau member, family member that's had a bad experience that and that actually impacts your decision making. I think also around the cultural safety of our services as well is huge. So how we as a workforce, we need more Māori health professionals in our workforce to care for Māori. So kaupapa Māori services by Māori for Māori can be enabled by increasing our Māori workforce, both in hospitals and in the community.